through like this. So eyeballs are up here, through your nose, those are your ears. Here's your brain. So want to make sure that don't see any evidence of any old stroke or anything like that, or any tumor or anything like that. You do have some what they call white matter changes. As we get older, we all kind of get white matter changes. It's just kind of a normal finding. Can it be other stuff? It can, but I don't see any real reason for it. And they're very subtle. See these little dots? There's little dots. So nothing big. Okay?
It's all in my head.
Say again?
It's all in my head.
No, I don't think it's in your head. And then MRI of your thoracic spine. You have some arthritis in your thoracic spine. Arthritis in the thoracic spine is a little bit less common, just because your rib cage is there. It holds everything kind of together, so it holds your spine together a little bit better. So you don't usually get as much arthritis. So you just see there's some bulging discs here, but nothing is big enough. Nothing is putting a lot of pressure on the spinal cord. Your spinal cord is pretty clear all the way up and down. See how this disc is a little collapsed down? So that can cause some pain sometimes, but my big concern was the pressure on the spinal cord giving you this jumpiness, spasticity, weakness, and things. So I don't see anything there. Your lumbar spine looks the best, which usually looks the worst on people because that's just where most of your weight is carried and there's no ribs there to help. But your lumbar spine, these are your discs, this white stuff's your spinal fluid, you see all the nerves flowing through here good. You have this stable little arthritis change here at L5S1, but nothing big pushing on your nerves, so nothing crazy. It's a little bit extra arthritis here from an MRI I had before.
That's the full back, right?
That's the full back, yeah.
Okay.
CT scan shows that you fused good across those levels we worked on. So this is your neck. So this just shows the bone a lot better. So again, you fuse real good through here. This level here, you still have some of this spurring out here.
That's my left side or right side?
This is more on your left side. And that's really the only thing that's of significant on your MRI of your neck as well. There's no definite cord signal change. There's still space around there, but the cord is kind of pushed over there. Could that cause this sensation on the left side? Maybe. It's just I've never seen it.
What makes my hand go up? I can't relax until I can sit on it.
That's what I mean. That's why we did all these studies to see if I could see anything definitively. I can't say 100% that's what's causing it in the neck. Have you ever seen a neurologist?
I thought I saw Dr. Ritchie.
You did see, right? What does he say? Does he say anything?
He said I had neuropathy towards the left side. He gave me drug after drug after drug. I wanted to kill myself.
Yeah, I know. Neuropathy usually doesn't make you shake though. Neuropathy can make you feel numb and everything, but it doesn't make you shake.
No.
Do you have any follow-up appointments with him, or?
I think he follows it every 6 months. We've done phone into my phone the last few times because of him.
May 25th is his next appointment.
May 25th.
Because this, you see, this is off to this is looking at you from your feet up. So this is your right side, this is your left side. And that little bone spur out here, it's going up to the spinal cord, but there's still space around it. The nerve that goes out that hole right there is, it goes down like this.
Comes from the feet.
But the spinal cord goes to the feet, that nerve does not. And a lot of the pressure too is kind of coming from behind the bone. If it's fused there, it shouldn't cause any problems. Again, the level below doesn't show a lot of movement when you flex and extend. This is what we're talking about right here. You see, you don't see any big, like this lifts up a lot or anything, but there is still just a little pressure on the cord there. I just don't know if surgery is going to do anything to help you there. I hate to put you through a surgery and it's not going to change.
I appreciate your honesty.
you know?
What makes it tighter here? Like you're seeing tighter and tighter hold up.
So all your neck muscles, I mean, they're operated on from the back there, but they all attach to the back of your head. If those muscles spasm at all, they'll pull down on the back of your head.
Because I can only hold it up like 20 minutes. Sometimes now getting real lot of
Yeah.
pain.
I know you use that thing a lot too.
Does this do any harm to me?
It should not do any harm, no.
I don't think so because they do implant them on some people.
Right. So nothing crazy on there. So you've only seen Richie through the phone?
One time in person.
I wonder if he could just see you and examine you if he has any of that. Now that we have all this extra imaging on you. Kind of want to get his thoughts.
Yeah. Yeah, he tried some tests last time. He came out with that neuropathy.
That nerve conduction, or what do you call it?
Nerve conduction study, yeah.
I
Yeah,
got
he did that was a long time ago, probably
Right.
2 years ago.
Yeah. Maybe he'll want to repeat it or something. Again, could we go in and remove some of that bone? So it's tough because some of it's behind this bone and it's in here and you've had that surgery there already. We could, I just don't know how much it would help you, you know? I don't want to put you through a big surgery. It's not as big a surgery as you've already had, but it's still a surgery
Yeah.
that may not make you any better.
So the nerve back here, this is real painful right here. There's a nerve that runs like this. The way I take away the pain, stick this in there.
Down through here,
Yeah, it goes right here. I can tase it right there and it feels better.
got
It goes down right there.
some of that is some C7, some is T1, see others. This T1 really kind of goes up into here. That T2, look under the thoracic and like, and just see if there's anything.
How about nerve blockers? And they got to do that often, every 6 months, I think. I don't want to be walking with my hand up in there either. I'm not that very-ish.
Yeah, I mean, I can see all these nerves coming out the side here. They all look open.
Open nerves,
Mhm.
that'd be great.
Yeah, I wish there was something on here. And we can say, yeah, we can do something and help it.
Yep.
I just don't see anything.
It's a miracle, I guess. 'Cause I don't want to get cut open either unless you guarantee something. Which you
Yeah, I can't guarantee. I can never guarantee anything, but it'd obviously something if I felt better about it than not. You know what I mean? I just don't think it would help you because I don't think you're moving much there,
Mhm.
and I don't see any signal change or anything like that.